So this is called Healthy
Healthy Start
Starts.
Kit,
Yeah.
So it's basically guided jaw growth.
Are you sleepy?
Ah.
So
Me too.
if the jaw grows properly, the teeth come in properly.
Slide back in for me.
But
Way
the
back
jaw is actually the opening to the airway. If it's underdeveloped, the airway is underdeveloped. So that leads to problems as an adult.
Okay.
And try to breathe through your nose. On her, do the small end, and you get the top arch first.
Okay. Open as wide as you can. A little bit wider.
Turn that down just a little bit. That's gonna be perfect. Now let's. Oh, I'm gonna do it on this side.
Okay. One more like this, okay?
Try to breathe through your nose.
Take some big breaths through your nose.
Alright.
You ready
It's
to
fine.
try? Okay. Open really big for me. Let me know if I pinch your lip, okay?
Yeah.
Can you bite your teeth together? Good job. Does that feel silly? Yeah.
Bite again. Yep.
Hold your teeth together. Good job.
Alright.
You're doing awesome. You see, Josh, isn't that funny?
What's
get-
funny?
You're
I'm
gonna get to
move
do
just
this
a little
too.
bit. Yeah, just gonna push it that way. Now bite again.
Let me see. Oh, that's funny.
Alright. Same thing on the other side.
Alright, keep your teeth together.
Alright, I believe I got all of those. Did I miss any? She knows better than I do.
I think that's it.
Alright.
There we go. So I just need you to open as wide as you can, and I'm just
That didn't hurt, right? It was fine.
Tastes bad though.
It tastes bad, but it was fine.
Alright. Try to have your feet even a little bit. That's perfect, just like that. Alright. So don't move the muscle. Well, you can breathe. Your right foot. Move it towards my foot just a little bit. Just perfect, just like that.
Oh, the cold air.
Smile. Big smile. Good smile. Alright. One more smile. Alright, now I want you to kind of look up at the sky. Alright, now I want you to do this. I want you to put your tongue right here and try to open it. Now try to open and put your tongue in there. Alright. Now turn that way. And I want you to look at that letter F right there. Okay? That's perfect.
you'll see pyramid.
And then
Oh,
it
wow.
looks like it starts moving, doesn't it?
Yeah, and then stuff.
So I will pull up this large one first, and
Oh, this is like a chiropractic.
so let's
Very-
get it on the midline.
Who's that?
It's like Billy Bones, right, guys?
What?
So this is the tip of her nose. That's your nose. Does that look like your nose? There's
So this is
your nostril, and the air comes in here, and these are your turbinates,
Yeah.
which are little bitty bones that then have soft tissue that comes off of them, and that can kind of help like slow down the airflow and filter. But
Ooh, I see a skull.
this is the back of the hard palate, and this is the back of the soft palate. So that little thing in the throat that you see hanging down, that's the uvula.
Wow.
This is the tongue. Did you realize your tongue was this big?
Wow.
That looks
Pretty
like
big, huh?
looks like a big frog almost, doesn't it?
Yeah.
What's the
Now
rainbow thing? What's the
That shows where the air comes through. And have you ever watched on TV when like they're showing like how much rain you were gonna have? And so the color coding tells us whether there's enough air space or it's getting smaller. So the more red it is, the more narrow the space is. So when she breathes in through her nose, kind of gets to the back of her throat, this area, if she's sitting up, is open. But if you lay down, rotate 90 degrees, lay it on your back, then this can drop back and close it off even more. And so we also have her biting with her teeth edge to edge right now.
Okay.
If she were biting like this, then her jaw would be even further back,
Got it.
which your tongue is attached to the jaw,
Right.
lower jaw. Your tongue goes back. If your jaw goes back, your tongue goes back. So upper airway resistance or obstructive sleep apnea, it all has to do with your ability to get air through your air pipe without having to work hard, and your body doesn't have to release bad, or not that they're bad hormones, but hormones that don't need to be released at that time. So essentially, if your airway starts to collapse and your oxygen levels drop, your body goes into fight or flight,
Yeah.
sympathetic nervous system
Yeah.
instead of parasympathetic, rest and digest. And so
This is interesting.
So
This is really
it
interesting.
really, our goal is to never get into fight or flight when you're sleeping.
Yeah. Okay.
Well, that causes all kinds of problems.
Yeah.
And one of the main ones is that your body never fully recovers. So how are you going to do the next day
Yeah.
if you're not really rested?
Right.
And so
And what percentage of our population is
It's
not
like-
rested? Yeah.
and what we're finding out is more and more than you realize, than
Yeah.
we realize.
Yeah.
So this is about where adenoids are.
Okay.
And so if we go to this angle, then we're basically looking from above and slicing down. So that's our nasal cavity. So you can see the
Wow. Yeah. We
Tip of
learned
the
all this
nose.
in school. Yeah. Interesting. Now she's my one too. If I don't keep her regularly adjusted, she has
Yeah.
way more sinus issues.
yeah.
Well, both of them actually through the years have been getting worse.
So when I get to this point right here, so you can start to see the teeth come into play, and those
Yeah.
are the maxillary sinuses.
Oh wow.
And the sinuses actually have a benefit that more than just humidifying the air that we breathe, and they actually can release nitric oxide. Nitric oxide is a natural vasodilator,
Yeah.
and it helps dilate basically the lung tissue. Well, this is where it's kind of restricting some, so
Okay.
those little humps right there are her tonsils. and we saw the adenoids at the other angle,
Yeah.
and they're not huge at all.
Right. Right.
But if her jaw drops back when she's sleeping, then that's going to restrict her airway more.
Okay.
So all of the appliances that we use put the teeth edge to edge, so it automatically opens the airway. And with this last one I want to show you, it's basically the one that to me kind of shows like, yeah, this is probably where the main problem is. So this is like we're looking at her,
Okay.
and that's the tip of her nose.
Okay.
So now we're like
See
we're
her lips.
going through her nose.
Uh-huh.
Let me enlarge that. So now you can see the
look
teeth.
at that. So cool.
Yeah. So as we go through her nose, this space
Ah.
is starting to narrow.
Yeah. That's what I thought.
You want it to be about 2 millimeters at its narrowest diameter or space. So keep going, keep going. It's not getting any bigger.
Wow.
So I was talking about the nasal concha.
Okay. Yeah.
That is, so there's like, you can see like the bone there, but the rest of that's soft tissue.
Right.
So with there may be a reason to do like nose sprays for a period of time to help with the inflammation.
Well, maybe we can find some essential oil. In
Yep.
those
And so
sprays. Yeah.
what I like is something called Clear, XLEAR,
Oh, okay.
and it's
yeah.
it's xylitol based.
Yeah.
And xylitol is antimicrobial.
Yeah.
It actually inhibits part of the glycolysis pathway for bacteria, so
Yeah.
it starves them.
Yeah.
And
Yeah.
it's more kind to the soft tissues than saline,
Okay.
so it doesn't desiccate them or draw out the. So I've been using Clear or the xylitol type spray for years myself.
Okay.
So if we can get her airway more open through the nose, then she can breathe through the nose. And if she does have any enlarged tonsil or adenoid tissue,
Yeah.
if she's not breathing through her mouth, then that can shrink. And a lot of ENTs will tell you after a certain age, they'll shrink really fast. So we just have to get to that age. So
Wait.
our goals are nasal breathing, jaw in the position to allow the airway to stay open, and then just let the body do its job.
Yeah.
Hey,
Yeah.
when will we get to the skull?
Oh, that's my favorite one too.
That's next.
So actually what I'm
Tell
doing
me.
is
Yeah.
I'm doing the treatment similar to this myself, but for an adult.
So your teeth coming through, sis?
Yep.
Skull.
So let's.
So how much longer till adults can come see you, Doc?
Still probably about another month. I'm kind of
Okay.
procrastinating.
Yeah.
I have to finish that presentation for you.
Okay.
Yeah,
But
you
I-
gotta finish the
I
last
started-
part of the training.
I started my therapy actually the 1st of July, and so what you have sutures right here,
Yeah.
right here, right here, right here, right here,
This
right
is what.
here. So this is all considered the mid face, and then also the palate, which
Yeah.
one of the things with the Healthy Start is that we're trying to use the forces of the tongue and the guides to grow the palate. So with her, you can see where the sutures are. So she actually has still a lot of growth potential because they're not even close to being
Close.
closed off.
Yeah.
And so we want this space between here to be big enough for her tongue to fit in there perfectly.
Right.
Awesome.
And the space for me is probably about the same space as her now.
Wow.
And so it'll take me about 18 to 24 months of wearing my appliance for 16 hours a day to to get enough room for my tongue to fit in the roof of my mouth.
Wow.
And when I'm done, I'll have spaces where I had teeth pulled for braces.
Oh, okay,
So,
okay.
well, here's the airway. If we make this wider, it makes that wider. And if we can get this to go forward a little bit, and we can't get it to go forward much, but we can get it to go forward a little bit, then it makes it bigger in that dimension.
Yeah.
But the biggest thing is this right here. So right now, her tongue can only go so far forward. If we can get her jaw forward and her tongue to fit in the roof of her mouth, then that opens up a lot of this right here. So obstructive sleep apnea is an anatomical problem.
Right.
And so if we get the soft tissue out of the way, then it helps. Well, the soft tissue is connected to the bone. So
Very interesting. Wow. Wow.
let's pull up Heroes.
So, just a reminder, we are learning about the Healthy Start that a lot of you have asked about, that is so much different than braces, or like my son says, the buttons that kids have on. And as a chiropractor, we learned that those were so bad for you because they didn't let the cranial bones grow correctly. And we put them on kids, right, at young ages where their brains, you know, are so affected, and that I even learned that it could cause scoliosis. So I was very excited to meet Dr. Graham and have this. I'm in Hattiesburg, Mississippi. I know some of you watching are as well.
All right. So I don't think I realized you were a chiropractor.
Yeah.
So actually, part of my training for the Vivos is to partner with a chiropractor.
Well, I'm not an active chiropractor in Mississippi. I'm retired, thank you, Young Living Essential Oil. Sorry. Yeah, I know. I have another chiropractor here saying there's not enough chiropractors. Yeah.
And really, the training that I'm doing, they recommend somebody has more like advanced training and like
Cranial sacral
like
therapies.
Atlas orthogonal or NUCA.
Yeah.
And the closest is like 2 hours away, I think.
Well, I will be promoting that this area needs that type of chiropractor because I'm still connected to the colleges. So
it's a COT, is that one also?
CBT, cranial bio
It's
orthogonal.
Atlas orthogonal is one of them. And
And then I know
then
NUCA.
NUCA. And I think there was one more.
There's one where they use balloons up the nasal.
Yeah. Well, and it's like
Yeah. Okay, Josh, this is
I was
you.
gonna say, Josh, this is your turn. You ready to look at your skull too?
Ready. And
He's
the other,
ready.
and the other things that what you showed Sarah.
Okay.
Yeah.
so his is neat because you can see the space between his tongue and his
Wow.
soft palate.
Okay.
What you okay.
So like you can really see where his hard palate is and his soft palate. So his tongue, and we have, like I said, we have the inviting edge to edge.
Okay.
So that's automatically going to postures the lower jaw forward. But all that space between the tongue and the soft palate can make this flap a little bit more.
Ah.
So there,
He has some spitting things going on too.
but the key is, his airway is, great, like below the soft palate, just like hers. It's more in this area right here, and so this is more of the adenoidal tissue, and so he probably is more constricted than her, and he's grown more than her. Well, let's
I'm going.
You are growing more than her.
No, I'm bigger than Sarah.
Yes.
That's correct.
Yeah. But I bet you your tonsils are a little bigger too.
You're
all
going
right. So we're coming from the top
to little brother.
down. So now we're starting to get in the.
Look at this, guys.
You see yours?
What?
Yours.
Good.
Pretty cool, isn't it?
So with his, you can see more like the tonsils.
Mm-hmm.
But it's not really restricting there. It's restricting more here, which is more that. So that's the adenoid.
Oh, okay. Okay.
And, well, that tissue can shrink without having to be surgically removed.
Okay.
And we just got to keep from inflaming the tissue
Okay.
as we go down. And see, like if his tongue or if his jaw were back, he may not have that space there between the uvula and the tongue. So the restriction is basically similar to hers,
Okay.
but he may have more inflamed or swollen lymphatic tissue.
He does.
I mean, like,
It's very
it's-
visual.
Yeah, I mean, like I'm not an ENT, but
Right.
I see something there that probably doesn't have to be there.
Right.
And I do know that a lot of these things can be resolved without surgery.
Oh, I thought we were gonna do the skull.
So now we're going to do your nose.
Skull's coming up last. See
Oh, look at your nose. Like you're looking straight at your nose, Josh.
More
I
centered.
think I see a booger.
Maybe,
That's
Josh.
not funny.
Okay. Okay.
I thought it was funny.
We do not say that.
It's okay to say that here. So a
Your
booger,
teeth.
a booger will restrict your nasal airflow.
Yes.
All right, so see how narrow it's getting right there?
Wow. Wow. Look at that, Josh.
And
Oh my goodness. How does one breathe
Yeah.
through the nose?
and so this is where something like, also, we talked about the sprays,
Yeah.
but breathe right strips,
Oh, okay.
because
Something pink.
we're trying to open up like the nasal valve.
Yeah.
And so if we can make the nose a little bit wider right here, that opens up this space right here.
Okay.
And so
Oh, my mom swears by those breathe right strips.
Yeah.
So.
And so
They do help,
another
for sure.
another thing, there are like nasal cones, which are like silicone inserts that you put in right before you go to bed to help open up your nose, and instead of putting like a Band-Aid on your nose.
Okay.
And
Well, Josh,
Here's your-
look.
Here's your skull. You ready?
Buddy.
Look at that, Josh.
so I'm actually 3D printing a skull in each section so people can see it better,
Oh, neat.
and it's just because it's fun.
Wow.
But you can see his
Sutures.
a lot better, and a lot of it's just how much I mess with the shading and stuff.
So that means they're not grown together yet, Josh.
Yeah. And actually what we found out is that throughout life,
Yeah.
these sutures are constantly remodeling
Yeah.
sutural homeostasis.
Yeah.
And so they want to stay the bone wants to be a certain width apart from each
Okay.
section. So it's around 250 microns.
Wow. But that's why we have these cranial sacral type cranial adjustments even. Yeah.
And so with
Pretty
somebody
neat.
that already has a so-called fused palate, which we know that we can rapidly expand a kid's palate up until about age 12.
Okay. Oh, so we're on the cusp, Josh.
But rapid is actually not the way the body would do it.
Oh,
So
okay.
rapid is an option if we can't get any kind of slow growth.
Okay.
Yeah, we're not able to see.
And this is going to help his teeth straighten possibly too.
Well, another big misconception is that teeth are crowded because they're too big for the mouth. the teeth are crowded because the mouth is too small for the teeth.
Ah.
And so the jaws, if muscle tone is proper and swallowing is proper, as the jaws are developing, they develop over the tongue, and the tongue basically is the scaffold. And the cheeks, if you swallow properly, do not push the teeth in and the jaws in, and so they basically just flow over the teeth, over the tongue, and they come in straight if they have enough room.
Wow. And that's
And so-
why
That's why I've sent you the video.
swallowing
Yeah, the
first.
swallowing technique, yes.
First. Okay.
So we have I have a lot of examples of adult patients or TMJ patients or sleep apnea patients. I have very few of them that have fully developed maxillas.
Wow.
So everything's crammed in because the jaw's crammed back. So the TMJ joint's crammed back.
And I'm just that same client I was telling you about. She's saying, you know, I feel like my mouth is crowded. She's got terrible TMJ, and she's had Bell's palsy.
Yeah. So
Wow.
the first thing that we would do for an adult patient like that is find a comfortable position for their jaw, which is usually moving their teeth like edge to edge.
Okay.
And so it does the same thing, pulls their tongue out of the way. And so a lot of people that have TMJ or adults that have TMJ probably have sleep disordered breathing.
Yeah, she's on a CPAP.
So, yeah.
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 She's
And this-
never rested. She wants
Yeah,
to
and
sleep
so
all the time. Yeah.
The CPAP, in order to be effective, really needs to be nasal cannulas or the nasal pillows where the air is only going through your nose and not through your mouth. So I don't like face masks for that purpose.
Okay.
Dentally, if you're having air circulate through your mouth, you're drying your teeth out and your gums out, so that causes dental problems.
Yeah.
And
Yeah.
that's not how we were designed to breathe either.
Right. Right.
So we want patients to breathe through their
I'm
nose
sorry, baby.
with their tongue suctioned to the roof of their mouth so that no air can go through. Well, most people that are on CPAP have a small arch. There's not enough room for their tongue. They don't know how to get their tongue in the roof of their mouth, so they have to be trained. And so for a lot of adult patients that have problems with CPAP, first thing I recommend is that they tape their lips together.
Yeah. And I've been
Lip
reading
taping,
about lip
yeah.
taping.
And so-
Yeah.
I've done that.
With ADHD,
Yeah,
autistic.
and
Yeah.
That's a way to train you to breathe through your nose.
Yeah.
And if you're breathing through your nose and your brain senses, I'm not getting enough oxygen, it doesn't let you die.
Right.
It releases nitric oxide
Oh.
through your
okay.
sinuses,
Okay.
and that opens up your airways.
Got it.
If you're breathing through your mouth, you don't get that benefit. So our goal from the beginning is nasal breathing and then tongue on the roof of the mouth. And if we can do that, then everything will fall into place if we have enough time. The guides just speed things up.
Okay.
I could talk about this all day.
I know.
I'm
We love
sorry.
it. No, we love it. We love it.
Okay. Anything else that you want to say, Doc?
Oh, come on.
So
No, I
The,
need to talk to you.
Okay. Can you give me 5
the
minutes?
best time to start this is around age 3. Yeah, is around age 3.
Okay.
And the reason that that's a good time is that they only have to wear the guides while they sleep and just passively during the daytime.
Oh.
And the older you are and the more dentally developed you are, the more you have to exercise with the guides
Okay.
to actually push the teeth and the jaw bones in place.
Okay.
So the younger we start, basically we're guiding their growth.
So you really would like to see kids as young as 3?
Yeah. And
Okay.
I actually would like to screen them before that.
Okay.
Because there are a lot of times we can figure out, hey, let's do this and you won't need anything.
Right. And, here's the thing, too, is that I have people watching from Pensacola,
Yes.
and, it's worth the 3-hour trip, the 5-hour, the 6-hour trip, to come to a specialist and get this, because it's not something you're going to have to come back weekly.
Yeah. It's one of those that most dentists that do this type of treatment, like, we don't mind working together.
Okay.
So, if there's somebody in that area, I can say, all right, go see them.
Okay.
And our goal is to get people healthy, and she knows, we have enough people that need it here.
Yeah.
I mean, not that we would turn somebody away, but
Right.
it's
Right.
if there's somebody that I can mentor in their area, I would also.
Okay.
And,
And of course, we need to get a couple chiropractors
Yeah.
here in the area
Yeah.
that are willing to work on the cranial and learn some of these techniques. Excellent. Well, thank you so much.
and also, and not that you have any pull on this, we do need a pediatric sleep specialist.
Oh,
We don't
okay.
have any.
Okay.
We had one years ago, but he retired,
Okay.
and so the closest one is in Jackson, which is
Okay.
an hour and a half away. So, we do have the rings where we can send the kid home with the ring to do like a sleep
Okay.
screening, but we don't have a true pediatric trained dental or medical sleep specialist.
Okay. Well, it's a wonderful place to live.
Yeah.
This area in Mississippi, the
Except
cost
for the
of
allergies.
cost of living. We
Keeps us
have.
busy though.
Yeah. Well, you can come see me for some essential oils for that.
Yeah,
Okay.
But it's all interrelated. And
Yes.
So my allergy, I'm an allergy sufferer, and I didn't have problems like it when I was younger because I was a thumb sucker, which means I had to breathe through my nose.
Okay.
It wasn't until I started breathing, until I stopped thumb sucking. Well, the problem is because I sucked my thumb, it made my palate too narrow.
Oh.
It guided. So if I can guide my growth with a thumb, why can't I guide it with something that is
Yeah.
the proper shape?
Right.
And so I sucked my thumb till I was about age 6 or 7, and at that point, my tongue didn't know where posture-wise what to do, so it basically kind of got worse and worse over time. And so, I take allergy medicines. Been doing allergy shots for about 1.5 years, and my allergies are much better. But the biggest thing also is that when I started doing Healthy Start, I realized the importance of nasal breathing. So I started mouth taping in 2017, and realized that when I was sucking my thumb when I was a kid, if I was congested, I would find a way to clear my nose. And if you do it long enough, after about 15, 20 minutes, all of a sudden your airway's open.
Oh.
That was the nitric oxide. And I didn't realize it now, but now I do.
That's so good. That's so good.
Yeah.
I even have some people, my friend here, who has some hearing issues. So we'll get this up on YouTube. So it has the transcription on the bottom, so everyone can hear and see what you've been. Thank you so much, Dr.
pleasure.
Graham. Thank you so much. We appreciate you
Lahoma
so
is
much.
Lahoma, yes.
Yes, Miss Lahoma, and our Healthy Start. Awesome.